You guys might have heard a lot of people talking about doing an evidence-based practice. But do you really know what does evidence-based practice mean? It's a very complicated term, sounds very complex, and feels very overwhelming that are we doing it correctly or are we not doing it? But before starting to do an evidence-based practice, you need to know what an evidence-based practice is. Fancy term EBP or your evidence-based practice, it comes in 3 steps. So you need to follow these 3 steps to understand whether you're doing an EBP or not. So the first one would be to find out what is the best research evidence that is present for your intervention. Second one is your clinical expertise or your best decision-making skills. Third one is your patient's values and preferences. Let's break these down into 5 different steps on how to apply the evidence-based practice. So the first one is using your PICO framework. Your PICO framework is basically your population, your intervention, C for comparison, and O for outcome measure. So first one is understanding what is the problem of your patient. Second, your intervention is understanding what treatment can be useful for that patient. Third one would be comparison. Comparison as in if you're using an ultrasound therapy or if you're using a TENS machine. So you're going to compare which one is better for the patient. And the fourth one is your outcome measure, that is which outcome measure or the scale that you can use to measure the progress. Now let me give you an example here. If a patient comes with you with a low back pain, so you're going to compare 2 treatment measures, that is whether the McKenzie exercises are better or manual therapy is better for reducing the pain. And that's how your PICO framework works. Now that you guys know your PICO framework, let's go to the second step. So since you know the PICO framework, now the time is to collect more evidence that your treatment or the protocol that you're using is correct for your patient. Now, how do you gain more evidence? So basically, you go onto your different websites on which you get the research articles like your PubMed, your Google Scholar, your Science Direct, your Cochrane Library. You go through all the systematic reviews and meta-analysis to understand whether the treatment that you're using has high level of evidence supporting it, that whether this treatment is good for the patient or not good for the patient and whether it's going to work or not. So since you selected different forms of treatment or intervention, you're comparing this with the research papers, which one is going to be the most appropriate treatment for your patient. Now, so you have got your PICO framework now. You have also collected the evidence for your intervention or the treatment that you're going to use. The third step will be to appraise these evidences. In simpler terms, basically, you're going to check the research papers which said that you can use these treatments. Are these papers actually reliable? Are they valid? And do they have a bigger effect size? Now, in some of the research papers, you might find that statistically, the results are really good. That is on paper with numbers. The results are really good, but the effect size might be really small. So then, practically, that treatment method might not work for your patient, because it worked for only a very small group of patients. So there's a high chance that it might not work for everyone. So in that case, then you need to find another papers as well, which are more valid and reliable, which has a higher effect size. Now comes the most important part, that is applying all this in your practice. So now you know what the problem is. Now you know what treatment you're going to use. You have also collected all the evidences for this treatment. You have also checked whether these evidences are valid and reliable and whether you can use them or not. So you use all these 3 steps and you combine it with your patient's preference. So now you need to check whether your patient is okay with this treatment or not. You have to check whether your patient is physically, emotionally, and mentally ready for the treatment or not. Example is, if your research study shows that dry needling is very effective for that condition, do not use it if your patient is needle phobic. And the last one is using your outcome measures. Your outcome measures are the scales that you use to check your patient's progress or whether a treatment is working or not. So again, you do the same thing. As for checking with the treatment or the intervention, you selected a lot of research papers. You do the same thing with your outcome measures or scale as well. I prefer doing it. So there's a lot of studies which actually show you whether a scale is reliable and valid to measure something or not. So based on this, you check whether the scale is reliable and valid, and then you use it to check your patient's progress, and always take feedback from your patient to improve your treatment. I hope all of this helps, and if it does, then save this post immediately so that you can continue using EBP or evidence-based practice in your everyday life and in your clinic as well.